Before we spend any time discussing and practicing counseling skills and techniques, I'd like to introduce and help you understand the key principles in drug addiction counseling. So, our goal here today is to help participants really understand, well, you guys, to understand the principles of drug addiction counseling and the context for counseling. At the end of this unit, you should be able to list and understand the 7 principles of drug addiction counseling and explain the implications of each principle. So, similar to HIV services, the services of drug addiction, the services that we provide in the community, really relies a lot on the number of clients who utilize the service. So, keeping that in mind, there are certain principles that drug addiction counseling tends to adhere to so as to promote quality services. These are voluntary, confidential, reliable, non-judgmental, respectful, safe, and also linked with other services. So we're going to discuss each of these principles in detail. So I want you to think about what you already understand about the term voluntary. Just take a moment and think about that. So when something is voluntary, it really means that the person does it of their own free will. Counselors help clients to identify sound solutions, but they don't have the right to force clients to do anything. Voluntary is this critical principle in counseling. So let's take the example of a male client who comes to talk to a counselor. The counselor explains the purpose of counseling and asks questions to assess the severity of that guy's drug use and talks about, different treatment options. Let's say the client does not want to commit to any plans. The counselor has to respect that decision. The counselor can encourage but not force the client to enter the treatment program. So, why do you think counseling must be voluntary? Take a few minutes to think about that. Why should counseling be voluntary? Hopefully you've had a few moments to think about this, so now we can discuss it. Counseling should be voluntary because we want the client to feel more open and comfortable. The service is going to be more user-friendly. Trust is going to be established and maintained. The target groups will spread the good reputation of this service. And sometimes clients are not willing to change their behavior right away. So having a positive experience in the session will make it more likely that the client's going to return in the future. And our counseling services must also be confidential. Confidentiality is one of the most important factors in the relationship between the counselor and the client. So, can you think of some examples either from your experience or maybe someone else's experience about any confidentiality related issues? You can feel free to pause the video to contemplate this for a moment. See, confidentiality is critical when working with drug using clients. It's important that confidentiality is assured at all times. Counselors need to remember that a client's personal information must be kept confidential, and they can't share it with anyone else outside of the professional relationship. So confidentiality prevents any reference to or discussion about a client, except in certain situations where it's professionally appropriate. And even then, it has to be done with knowledge and consent of the client. And in some cases, confidentiality will need to be breached if the counselor finds that maybe the client is, either knowingly placing him or herself or someone else at risk. One example could be if the client informs the counselor that they're considering suicide. In this particular circumstance, the counselor should advise their supervisors of the risk and determine what course of action should be taken. So, how important do you think it is for you to provide reliable support? How can you tell if a person is reliable or not? Are they consistent? Do they show compassion and humility? Do they respect boundaries? Do they compromise and don't expect something for nothing? Are you both relaxed? Are they respectful? Maybe do they show gratitude? There's a multitude of things that can tell us whether someone is reliable. And we have to flip that around and understand that our clients are looking at us to be reliable. And a client will view a counselor who's reliable as sincere. Reliable counselors are also punctual and predictable and caring. Clients of reliable counselors feel that they're being listened to and cared for by their counselors. Counselors who provide accurate information and clear explanations and appropriate referrals will be viewed as more reliable than those who don't. A reliable counselor is also going to keep their client's personal information confidential. So take, for example, a situation where a client says to a counselor, "I'm very concerned that I might go back to using heroin again. I'm spending a lot of time thinking about seeing my old friends who I used to take drugs with. I can't stop the feeling that I would like using it again." And then while saying these things to the counselor interrupts him and says, "What is wrong with you? Don't you care about what other people expect of you?" Okay, so what do you think the consequences of this kind of counseling approach would be? The client's probably going to shut down and not share any information like that with the counselor again. The client could feel judged or condemned or demeaned. The client might even give up on their recovery and go use after that session ends. So it's important for us to always stay neutral. Try not to judge or react strongly to your client's issues, and it's important to pay attention to your body language. This is going to help you to keep in control and remain open to change. Counselors will be able to counsel successfully when they learn from their clients' experiences. Use the information that you gather to guide the discussion instead of shutting it down. Having a good understanding of your client's perceptions of norms is really important. It helps you to relate their beliefs to the range of possible options that you can help them to consider. No principle of good counseling can stand on its own, alone. Each really just supports the other. So we've discussed the need for services to be voluntary, confidential, and non-judgmental. Services also have to be respectful and safe and linked to other services. And having respect for your clients means that you treat every client the same. Your attitude toward them should be consistent, regardless of their age or their gender or their appearance or their social position or their financial status. Respect your clients as you would respect others or have others respect you. Mutual respect ensures effective communication and that counselor-client exchange. So with mutual respect, clients will become more cooperative and open and comfortable to share with you their real problems, which enables you and your clients to identify some sound solutions. And when we talk about the need for safety, who and what are we talking about? How do we ensure safety? We need to make sure that we ensure the safety of the clients and their information, the clinic property, and the broader physical environment, among a whole list of other things, but those are the three main ones that we really need to just pay attention to. Participation in drug addiction counseling really brings stability to a lot of our clients. And this stability allows them to deal with a variety of other related issues that may be beyond our skills and expertise. So problems like housing and employment or health-related issues like HIV and legal problems, these are more likely to be managed in an effective way when the person is in drug addiction counseling. So linking these counseling services to the other services is really an important component of effective drug addiction counseling. And this is where your case managers are going to come in, and we can work hand in hand with those case managers to help our clients in linking to the other services, especially aftercare services. We want to follow through with those services. So, a good understanding of and adherence to the 7 principles will enhance the client-counselor relationship. And the 7 principles are interlinked and supportive of each other to ensure the success of counseling.